This is Haiti Merritt with Insulination. We're here at Joslin Diabetes Innovation Summit 2012 here in Arlington, Virginia. And I'm here with Larry Solar from Partnership for a Healthier America. Hi,
Hello.
Larry.
How are you?
Thanks for joining us on Five
Thanks.
Spot.
Great to be here.
Great. What is your greatest aspiration in combining technology and healthcare?
Well, for us, we're trying to solve the childhood obesity epidemic.
Yes.
Right? That's our goal
It's
here.
huge.
It's huge. It's been growing for a long time.
Yep.
But we really now have a tremendous opportunity to turn this thing around. People are actually now paying a lot of attention to the issue.
Well, it's hard to ignore.
It's very hard to ignore, and we've had a lot of luck having the First Lady out there talking about it, and others who are making a real impact. And I think technology is something that's going to be, I think, a big part of the solution, but we've also got to make sure it's not a big part of the problem.
Right.
So at the same time that technology can be very effective in helping motivate children to be active, to get their 60 minutes of activity a day, to understand more about food and nutrition. At the same time, we know that children, when they think about play, they think, when we were growing up, we thought about play as going out and playing. Nowadays, it's more about screen time.
Right.
And so I think it's a balance of really trying to get the best we can get out of technology, but also trying to keep it from overtaking everything in a way that's not helpful.
That's interesting. My mom used to lock us out of the house.
Oh, that would work.
She denies it now. She refuses to believe that was something she would ever do, but she did. Because I used to love cartoons. Anyway. The catchphrase for the event is be considered part of the solution. What does that mean to you? You sort of covered that, but...
No, I mean, for us, it's really about coming together. And when you think about childhood obesity or diseases, whatever the case may be, whatever you're working on, for us, we're thinking about physical activity, food, healthcare, early childhood education, schools. There's a lot of different sectors of the country that are working in those areas. You got the private sector, you got NGOs, you have government, you have academia, you've got nonprofits, you got philanthropy, and a big part of our mission is bringing those sectors together, and sometimes they're at odds, and trying to have them kind of leave agendas at the door and work on solutions together.
And that's the next question. Do you think the summit here, it's definitely about working as a team and not using competition as the motivator, but using pooling our resources and our research and, getting the job done. Do you think that's going to be as effective?
I do. I mean, I think there's roles for both competition and collaboration.
Right.
So when our core part of the work that we do are developing voluntary commitments by the private sector to solving childhood obesity crisis. And competition is definitely part of companies wanting to be first there and show their interest in being part of the solution here. But at the same time, I think collaboration is going to be the long-term approach to solving this thing. For instance, we're going to be working with health plans, working with hospitals, working with insurance companies, working with physicians. There really needs to be a lot of collaboration there to solve this.
Right, and plus with all the information being online and out there with the public, it's hard to really keep something quiet enough to be competitive. You really have to share it and work with people and let them know that you're a player.
I definitely
I just added that in on my own. All right, so we have 3 cards here. We have community-based healthcare solutions, technology in patient healthcare, and patient-provider relationship and interaction. In what degree of importance would you put them in?
I think they're all very important. And so I would say that for childhood obesity, I think community-based healthcare solutions is absolutely critical. And I would probably broaden that from healthcare to just solutions, community-based solutions. So part of it is going to be healthcare, so it's going to be the interaction with the physicians and the healthcare practitioners, and ensuring that patients who come in are at risk of obesity, the 1 in 3 kids who are overweight or obese, and those are on the way to that, will be given the right opportunities to resolve that with community-based. But beyond that, it's also making sure that the environmental issues that people will face, whether it's the food that they eat, their opportunity to be physically active, that's going to be key at the community level. We want to make the healthy choice the easy choice for families, and a lot of that's going to be based on their environments. So I think
because healthy food is more expensive, and
it can be. It's not always. Sometimes
I know, but I mean when you are looking to feed a family, it's easier to just go to like a fast food or something quick with calories and energy than it is to like buy something healthy and prepare it.
It's appropriate for families to enjoy time out and have a wide variety of options there. But I think what's happening right now is that unlike 20, 30 years ago, families are going out multiple times each week.
I know.
And so like
a day.
Yeah. So one of the things that we've done is we've worked with grocery store chains, Walmart, Super Value, Walgreens, to build or serve fresh produce and build new grocery stores in areas that don't have those access.
Right.
You can drive around certain areas in cities in rural America for hours and not see a grocery store. At our Building a Healthier Future Summit last year, we did a chef's competition where we gave the chefs a couple of dollars to serve us a healthy, delicious meal.
Nice.
And they did it. And that was cheaper than going out to fast food.
Right.
So we think everything's in moderation, but recently hasn't been quite as much moderation.
Right. Okay. So that was the first one.
That was the first one. I would say the next one is probably technology. Technology, as I mentioned, is going to be a big part of the solution, but we need to make sure it's not a big part of the problem.
Right.
So,
do you think too that like sometimes technology is going to leave people behind if they're not tech savvy? That in this time, you know, everything is kind of, it actually seems like we're kind of segregating out, or you know, leaving out some people.
Well,
it's not as broad.
You're right.
Technology is sort of centered.
It depends on, and so there's a lot of people who are thinking about what's the next app on the iPhone,
right?
What's the next big thing? But there's communities that is very affected by these diseases and childhood obesity that don't always have access to these expensive technologies, which is what you're saying. And,
yeah, thank you.
And so yes, we're very concerned about that, and I think part of our challenge needs to be to these entrepreneurs and small companies that are creating these things, or even large companies. Let's not leave those folks out of it. So we know that just about everyone has a cell phone.
Yeah.
May not be a smartphone. How can we use what people have to make them successful in this effort? But I think you're right. That's a clear hurdle.
Right. The wild card question is: do you have a sweet tooth?
You know, to be honest, I would say not as much as most people do.
Okay.
I'm more of a salty,
savory
kind of guy. So if there was a bag of potato chips here, I'd start eating them.
Great. Well, thank you for your time.
Thank you.
Thanks for joining 5 Spot.